My name is Katrin. I'm an occupational therapist at Monument Health Spearfish Hospital. In my role, I do see patients in our hospital in the acute inpatient setting as well as in an outpatient therapy setting. As an occupational therapist, my job is to facilitate people's engagement in their daily occupations. So everything from getting dressed, taking a shower, using the bathroom, all the way to meaningful activities they enjoy, like taking care of a grandchild, going to work, even just playing a sport that they love. So seeing patients in an acute care setting means that these are people who are in the hospital who are sick or who have recently had surgery or an injury. When I'm seeing people in this setting, oftentimes the goal of my therapy is to make sure that they can independently move around safely, independently get dressed and get to a bathroom, and start progressing their return to their normal activities. Often things that we don't even think about being difficult, like washing our face, brushing our teeth, even wiping our bottoms, is something that can be very difficult after you've been sick or after you've been hurt. While your body is recovering, it takes a lot of energy to take care of those injuries and those illnesses. So I work on progressing people's strength and balance and independence to participate in those tasks, as well as helping them find strategies to do them a little bit differently or use tools if they need to make up for that increased weakness or pain. I also, after receiving my doctorate, I received 2 additional pieces of training. The first was in lymphedema. So I'm a certified lymphedema therapist. Lymphedema is abnormal swelling of a body part, sometimes from a genetic difference and sometimes from an injury or an illness. People most often associate it with breast cancer after having lymph nodes removed from your armpit region. This is something I was introduced to as a student, and I really found it to be a rewarding piece of therapy. So I did go on to receive my certification and then also an additional certification from the Lymphology Association of North America. And this really has been a rewarding thing for me to work with people who do have this abnormal swelling. First of all, to reduce that swelling, to allow them to move more independently, wear clothing typically, participate in their activities without getting as worn out, and then also to increase their self-efficacy or their self-independence of taking ownership of this condition that is a lifelong condition and manage it more successfully and independently at home to have a long-lasting, higher quality of life. Many times when we're seeing patients in the hospital, I'll work very closely with my physical therapy counterpart working with these patients, and sometimes even seeing them at the same time if they need higher levels of assistance. When I'm working with my physical therapy counterparts, I'm looking at things a little bit differently than they are. They're often focusing on strength, motor patterns, endurance, how they're walking. The physical therapist can give you much more detailed information about that. While I'm looking at motor patterns, I'm looking at strength, but I'm also looking a lot at functional cognition. How are they sequencing things? How are we processing things? I'm using meaningful activities to motivate that activity and to promote more typical patterns of movement and typical patterns of engagement in those activities. Even things like putting on your socks. Your physical therapist cares very much about your hip flexion and ability to cross your legs and touch your toes. I care a lot about, are you able to do those in order to put on pants, put on socks, clip your toenails, wash your feet, all of those types of things. After graduating high school, I did go on to get a bachelor's degree in biology. And then to become an occupational therapist, you have a few different options. To be an occupational therapy assistant, you can receive a bachelor's degree. And then to become an occupational therapist, you can receive either a master's degree or a doctorate degree. I did choose to pursue a doctorate degree in occupational therapy for a few reasons, one of which is that I really enjoy a teaching aspect, and having the option of returning to a role like a professor is something that's of great interest to me. As well as with a doctorate degree, you do receive additional education in things like management, leadership, and progression of the field to do research or open a private practice, which obviously right now is not something I'm doing, but that is something that was very important to me to have a solid background if I do choose to pursue that someday. My youngest brother has cerebral palsy, and growing up I went to therapy with him all the time. So that's how I knew that I really wanted to get into therapy. And I found that I always had the most fun at his occupational therapy sessions. I really felt like his therapist brought my other brothers and myself into his therapy sessions and made it a whole family event. And that really was important to me. So I always thought, I want to work with kids. That's going to be my thing. And then while I was in college getting my biology degree, I worked at an assisted living facility and found that working with older adults really was my passion. Never saw that coming, but I found that working with older adults was wonderful, and I've had the opportunity to work with older adults in skilled nursing facilities, in home health, in the hospital, and seeing them as outpatients, so people who just come to the clinic for therapy. And in working on all of these different roles, I've had the opportunity to see people through the entire spectrum of rehab, which has really been fun for me to watch them progress from being very, very ill in the hospital to not able to leave their homes to able to come to therapy and see me in this colorful gym. And then the other surprise was I went from wanting to work with children to only wanting to work with older adults, and now I see kids too. A couple times a week I get to work with pediatric or child patients, working on their ability to complete tasks by themselves, work on their handwriting, regulate their emotions and their feelings, and process the world around them, which really can be a fun and rewarding thing to watch, a cute little kid blossom into a bubbly, playful child who enjoys interacting with their parents and their teachers and their peers. I love all kinds of things about my job. I've known for a very, very long time that I wanted to be an occupational therapist. It just makes sense to me to be able to find the things that people enjoy and not only help them to achieve the ability to participate in those activities, but also using those activities as part of my therapy. As an example, I used to work in home health, and I had a patient who was an older woman who really valued writing letters to her family. That just was something that she loved to do. We also were working on some increasing her strength and her ability to participate in activities for longer periods of time. So we would stand at her kitchen counter to write letters. It sounds so simple, but all of a sudden this woman who was barely walking from her bed to her bathroom was standing for 10, 15, 20 minutes at a time at her counter, engaging in an active activity because it was something that she loved doing. And now she has much more strength and endurance and is walking around. Sometimes I see her walking around the block, and it just makes me smile every time. As occupational therapists, a fundamental part of our evaluation process the first time we meet a patient is getting their occupational profile, really finding out what's important to them. How do they see themselves in the world? What roles do they have that are important? What activities do they have that bring their life meaning? And then using that information really helps us to develop a great relationship with these individuals and help them to live their life to their fullest and really feel like they have purpose and meaning aside from just getting out of bed every day.